To you, good evening for me.
Good morning to you. Or what time is it in Israel?
Now it's 9 p.m.
Oh, so it's
So
almost
I'm a
nighttime almost sleeping time for you. Let me go ahead and pause these videos first here.
just
And
more.
let's do a quick testing while we're talking here. Can you guys hear me through the webinar? Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3. Are we all
I
good?
hear.
Perfect. Good morning, afternoon, or evening, everyone. Welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Here at eLotus, we are the leading acupuncture CEU provider offering the largest selection of courses for acupuncturists. So if you're here looking to learn something that you can apply in your practice right away, you have come to the right place. And one of the ways that we are able to help you is through our email list. We are always sending emails about our upcoming webinars, such as today's class. We host a free weekly webinar, and sometimes we will have 2 free weekly webinars. Like this week, we have one today, and on Thursday, we have one with Dr. John Chen. So if you want to stay updated on the webinars that we are having, as well as promotions, where we will also have free webinars on the weekend, please do sign up for our email list. We're also on Facebook, so if you have a Facebook account, please search us, eLotus.org, and like our page. And we also have a Facebook group called Acupuncturists Online, where you can connect with your colleagues from all over the world. So today's class is Tongue Diagnosis in 5 Elements model with Aaron Zizov. And he completed his graduate studies in acupuncture, herbal medicine, and shiatsu in 2004 from Midline College, located in Tel Aviv, Israel. He specializes in gynecology and Chinese cosmetology at the Zhejiang Chinese Medical University and the Zhejiang Province Hospital of TCM in Hangzhou, China. In addition, Aaron has also taught at leading colleges in Israel and is currently teaching professional workshops and countries in Israel and Europe in Chinese cosmetology, tongue diagnosis, and Chinese astrology. Aaron's focus is on understanding the personalities and the emotional issues of his patients. So let's go ahead and give him a big warm welcome. And Aaron, if you can do a quick testing on your end one more time so we make sure that we hear you.
Okay, test 1, 2, 3. 1, 2, 3.
It's great. Thank you.
Okay, great. So welcome all, and thank you for coming through the incredible internet and the option of studying, and for me the teaching of the essence of the practice, I think, in what I do on my daily practice. Tongue diagnosis for me is a big thing, because since the moment I started practicing, or even as a student, I was always, as Donna mentioned, I was very interested in understanding personality, and not only just to see the basic signs as we studied in the college in Chinese medicine in TCM. Even in China, in my experience, in many times I would ask the doctors, but don't you see that there are different aspects? And because it was very fast, many of the doctors didn't really pay lots of attention to the details on the tongue. And I see it quite important, actually, to the practice to analyze the tongue, to understand who the person is, and according to that, what kind of treatment we need to practice. So I will go to the, So this is me. As Donna mentioned, I'm practicing since 2004 with Chinese medicine, shiatsu, and herbs. I studied in China in 2008 for like a few months, and I published 2 books. For now, they are in Hebrew, but soon they will be in English edition. My first one was about the Chinese cosmetology, and the second one about tongue diagnosis. The next one, soon, in a few months, will be about Bazi astrology. And basically, as teacher, student who's teaching in order to study more, I would say that I'm teaching on the last decade. Started in Israel, but on the last 4 years, I'm teaching abroad, giving workshops in Europe. And in my practice, I combine my private clinic and Maccabi Healthcare Services, which is like public healthcare services. So in total, in a week, I see more than 100 patients in a week, which gives me lots of experience for diagnostic and this diagnostic tools that I'm using with the Chinese astrology maps and, of course, the tongue diagnosis. And of course, the big advantage of tongue diagnosis is that it's quite fast. So in a few seconds, before I ask what the problem is, I look at the person's or the patient's tongue, and in a few seconds, I get the focus of what to deal with or what to search in the other questions or other details that I want to get from the patient. And according to that, the treatment is coming quite obvious and quite clear. So basically, on this lecture, I will try to give the basic introduction about the basic principles of diagnosis in TCM, the different philosophies and how they are connected to tongue diagnosis. Of course, the substances, and again, their connection to the tongue diagnosis. The tongue itself, how we look at the map of the tongue with some different focuses, not so different, but more detailed, interesting way of looking at the tongue, on 11 categories and 5 association areas, which I will give more details in one of the categories and one of the association areas, because unfortunately time is limited and I can't get it all in 1 hour. And at the end, I will give some examples of cases of how I actually do that as a step-by-step diagnosis. So I would love to give your responses even during the lecture, but I think it will be better to give all the lecture, and at the end of that, if you have any questions, I will be happy to answer. So collect the questions, and at the end of that, because it will be quite difficult for me to follow during the lectures, all the questions that you ask. So if you're all ready, I can start. So I want to start with the quote that I like the most about. I take it to diagnosis, but the ordinary physician treats the disease itself, and the excellent physician treats the disease and prevent its transmission. Basically, this is from Nanjing, but it always reminds me that when I look at a patient, I need to see the source of his problem. It can be emotional, it can be, of course, physical, but it's always important for me not to look at the symptoms, but to go deep as possible to understand the structure of the personality, and according to that, to understand how it can create some kind of imbalance or disease. So a bit about the introduction. Health and disease in Chinese medicine, we can say that basically health is balance, and balance is listening to the laws of nature and understanding the natural basis of the person, to understand the qualities, different qualities with strong aspects and deficient aspects of the person. And disease on that side will be the imbalance and the weakness of the body according to different external factors or internal factors. This, of course, will give us the understanding of the full diagnosis. We can say that basically we want to collect the clinical information from the patient by inspection, by listening, or even smelling, by palpation, of course, palpation of the pulse, inspection of the tongue, of the face, of all the whole appearance, listening to the voice and smelling the different smells of the person that can give us different clues. And of course, the questionnaire, I love to do it at the end of that, because after we see first and not getting confused of the many details that the patient can give us, we can be very focused and ask the exact questions in order to understand the pathology. Then we need to analyze the data, and according to the etiology, the nature of that, the location of the pathology, of course, to understand the condition and how it goes, where it goes, and according to that, basically, we see the changes of the disease, how deep it goes, if we go about the 6 channels, if we go about the different meridians, or if we go about the Zhang Fu organs. So we need to understand all that according to the external factors of climate, of environment, of emotions, and the internal factors that affect organs, meridians, qi, blood, and different substances. After all, we need to analyze that and to get a clear way to get to the treatment. Now, if we go, now I will try to do it fast, because again, it's only 1 hour, and it will be difficult to go through the whole history of tongue diagnosis. But basically, since the Shang dynasty, shamans, through with bones, they actually described different inspections of the tongue. And the Zhou dynasty, different first indications of combining the inspection of the tongue as part of traditional medicine. During the warring states, of course, there were the different models of the important theories in Chinese medicine, yin and yang, and 5 elements, Taoism, and so on. And the Nanjing and the Huangdi Neijing, there were descriptions of rolled tongue, stiff tongue, short, loose tongue. The color of the tongue was another indication, and the coating a bit. Through the Qin and Han dynasties, Zhang Jing, he was actually the first that mentioned the yellow coating and connected it to heat diseases. In the Shanghan Lun, basically, there was a description of 30 different pathologic tongues. During the Sui and Tang dynasties, we can see indications of swollen tongue and stiff tongue, short tongue. San Si Miao connected the tongue diagnosis to Zhang Fu diseases. During the Song and Jing and Yuan dynasties, we can see that there are indications of tongue connection to tongue diagnosis with core diseases. Du Qing Bi, he was one doctor that wrote a clinical guide with 36 pathological tongues. During the Ming and Qing dynasties, there were already a few books with description of like 120 tongues and the differential diagnosis for all of that. And in modern China, of course, many more books that were describing more advanced aspects of tongue diagnosis, and of course with the different technology that was advanced, different physiology and thermographic shooting that showed more pathologies and actually made the connection to the theories of traditional Chinese medicine. So I know I'm running quite fast because I don't have you in front of me, so I'm just going on. So philosophies 1 to 5, we can start with the Tao. Tao is the one that contains the whole in that, so we can consider the whole tongue that holds the personality, the whole person. When we look at the tongue, we look at the person, not just you know, the coating or the color or the shape. They're all connected, okay? And of course the different association areas. And yin and yang, we have the relatively, and basically they symbolize the changing reality according to yin, which is more, of course, nourishing, more heavy, more cold, more easy, more slow, and the yang is more dynamic, hot, and more fast. We can see on the 3 treasures, the 3 which is created after the 2 of yin and yang, the 3, the chi, which is coming, gives us the ability to look at the heaven, man, and earth. Later on, we will see how we can describe the tongue in 3 parts. So after that, we have the 4 seasonal and direction, seasons and directions, and the climates that we can see on the tongue. And of course, the 5 elements, where we will see the different association areas. So just for the example, yang tongue, or tongue that describes yang energy, we can see it's quite long, it's quite red, okay, it's quite narrow in comparison to yin tongue, which is more round, more, we can see the more swollen. Okay, just a basic comparing between these 2. And later on, when I'll talk about the shapes, the different shapes, we will be able to see the different personalities. So just with a fast look, when I look at, for example, the yang tongue, I can see a person who's fast thinker, his restlessness, he's anxious to do things very fast. So he thinks fast, he acts fast. In comparison to that, the yin tongue, yin person, we can say, is more slow, taking things very easy, and takes more time for him to act in life. When we look at the heaven, man, and earth, we can see the 3 parts. When we look at the upper part, which represents the heaven in a way, the middle part, which is the man, and the lower part, which is the earth. Okay, later on I will talk in more specific way about each one of them. The 4 climates, I will talk later about the climates, but the 5 association areas, as I guess most of you or all of you know from the basic understanding of 5 different areas: the heart, which represents the fire, the lung, which represents the metal energy, and spleen, stomach, of course the earth, the kidney, bladder, the genitals, and reproductive organs represents the water, and liver and gallbladder, and the sides represents the wood energy. So basically, when we consider the 5 substances on the tongue, we consider qi. Qi, shui, blood, jing, the fluids, body fluids, shen, and jing. For each of them, I will give some indications that we can see. So, for example, the qi. So we know that the sources of qi will come from constitution, kong qi and gu qi, and of course, the qi is responsible for the breathing, for digestive, for protection, defense, for the movement and pushing the blood. And of course, every organ has its own qi and his own responsibilities. With the pathologies, we can see different pathologies. We'll start with qi deficiency. We can see the qi deficiency on the whole way of looking at the tongue, but basically on the upper part. We can see that the area of heart and lung is basically more weak, more loose. So we can consider their qi as deficient. Now, when I look at this kind of tongue, I will immediately ask the person if he has different pathologies of these specific organs. Okay, of course, we will be able to see more pathologies with other areas, but this gives me the first indication. So I will ask about the fire or the heart, about the energetic or the vitality, basically. How is the vitality? Does the person have enough energy? Is there any kind of breathing problem or respiratory diseases? So it gives me the first impression of that. Okay, when I look at chi stagnation, we can see basically on the sides of the tongue that they are more stiff. So I know that the liver and gallbladder control the sides. Okay, it's like the person is more stiff on his behavior and his all basically the way he acts in the world. So it's like lots of pressure on the sides. It means that the chi of the liver and gallbladder is more stagnant. So I will ask questions according to that. When I see chi rebelling, how we can see that? You can see the little crack here, and actually this patient has lots of heartburns and nausea, and we can see also according to the coating, but specifically the crack here can represent in, like I would say, 80 or 90% from the times I saw that, this kind of crack in this specific area, because it's an area between the lungs and the stomach. So it's basically anatomically represents this area in the body. Later on, we will see the whole body reflection on the tongue. But basically, I will ask, do you have any tendency to nausea or any kind of throwing up or whatever? Okay, so again, it's an example for that. Chi sinking, we can see that we can see that in specific areas, and this tongue, we can see that it's all over the tongue. When the middle of the tongue is sinking, we can relate that to the different organs that appear over there. Okay, so we can ask about the heart, okay, which is mostly for the emotional aspects, about the lung, immune system, or phlegm, which is stuck in the lungs, or of course in the digestive system. We can see more examples for that later, and so on. Okay, so we go through the whole body and understand it according to that. The blood shui, we can consider that the sources of the blood are connected to the sources of the chi. The blood is responsible for basically nourishing the organs, the tendons, the muscles, the skin, the hair, all the nourishment that the body needs. Responsible also for anchoring the shen, okay, the heart of the blood is connected to that. And with the pathologies, different pathologies, of course, we can see that in here. I don't want to get into the details, but just to remind you the sources of, with this diagram, the sources of blood, how it's created, and so on. But in the pathologies, we can see deficiency of the blood, which is quite obvious when we see a pale tongue. It means that the blood and its quantity or circulation, quality, quantity, circulation, they're all weak in a way. So we can see that on the sides, in the middle, the color of the tongue is pale. So immediately I will ask about any kind of anemia, how is the period, how, according to the problem that the patient comes with, I will direct my questions. Okay, so this is, again, deficiency. We have a stagnant or stagnant blood or stasis of blood. We can see the tongue is more red on its color. And that can give us another indication of different problems all over the body. Okay, sorry, I'm trying to see on the chat what you write, but later on I will take a look at all of that. I'll continue. And some heat in the blood. So here we can see that actually the color up is not so red, but on the sides all over, we see that the color of the base of the tongue is red. So we can refer that to heat in the blood. All kinds of skin disorders, all kinds of acne, skin issues that we can see red, of course, heat in the blood, and all diseases or problems which are connected to that. Okay, again, this is a brief introduction for that. With body fluids, we can see basically that body fluids are responsible for nourishing the different tissues and organs, or lubricating the joints and balancing the temperature, of course, in the body, and also responsible for losing the waste through the sweat and the urine. And the different pathologies that we can see are basically, again, here's the whole process of the creation of the body fluids. With the pathologies, we can see deficiency of body fluids, which is basically dryness. We can see the cracks, that the tongue is dry, and we see different cracks. Okay, this is in comparison to stagnation or accumulation of body fluids, where we'll see the whole tongue is swollen. So even if I take a look just on the tongue without seeing the person even, and I do that quite a lot from long distance diagnosis, online diagnosis that I do, not all the time I see the whole face of the body. So according to this, I can see that there is a tendency to accumulation of fluids in different places in the body. I can ask about different edemas. If I have a facial picture, I will try to see different areas like the lower chin or under the eyes, if there's any accumulation of fluids. And again, it will help me to go on with the specific diagnosis and, of course, with the treatment. When we talk about Jing, so it's mostly about the deficiency. Of course, we don't have excess of Jing, but the Jing we can see in the root of the tongue. Whenever it will be, as much as it will be low, okay, the part of the root of the tongue, it can give us a clue about the weakness of the Jing. And in cases of Shen, we can see the disturbance of Shen mostly on the tip of the tongue. Okay, so the Jing is on the lower part and the Shen is on the upper part. Okay, we can see the connection between kidney and heart. Okay, so the disturbance will give us another clue of how we can treat, what we need to do, where the qi and blood flow, and how it affects different emotions, and so on. So a bit about the tongue diagnosis, just some water. So some understandings of the tongue diagnosis itself. So we know that it's one of the main diagnostic pillars in TCM. In the practice in the clinic, I will use abdominal palpation and pulse palpation, and mostly the tongue. In advance, I will prepare a map for the majority of the patients to understand what the energetic DNA of the person is. But as one of the pillars, we can say that because it's a somatotopic system, we can see on the map of the tongue, we can see all the different areas. Because it's epithelial tissue, we can consider it's the only organ, which is actually basically it's a muscle, but it's the only muscle in the body that has a direct connection to the internal body. So we can see what happens inside just when a person or a patient takes the tongue out. So it's a big advantage also. I will discuss in the next slide about more advantages of the tongue, of the method. But of course, we can see the internal organs, energetic systems as a whole. When we look at different systems, but we can see the whole connection to that. We'll talk about it more, of course. And we also can consider emotional and physical situations, which is very important. I think the majority of the problems, even orthopedic problems, in many times, they rise because of some emotional state of the person. And we can see that through the tongue. So if we look in more detail about the tongue map, so we can see the heart area, the tip, we can see the lungs area, we can see in the middle part of the middle area of the tongue, we see the stomach, and on the sides of that, we see the spleen pancreas, which I will call the emotional part of the earth element. Here we will see mostly the overthinking or many thoughts. Later on, I will give some examples for that. But I give the difference. I do the difference between the middle part of the middle area and the sides of the middle area. Okay, of course, the lower part will be kidney, bladder, and reproductive organs more a bit at the back. Between the stomach and the kidneys, on this area here, many times we can take it also from Ayurveda, from the Indian medicine. We can see here the intestines. Okay, so many times we can see coating, yellow coating or white coating just on this area, and this in Ayurveda it's called ama. Basically, it's too much. I would say toxins in a way. Okay, and of course on the sides, I take all the side from the top to the bottom of the sides. It's responsibility of liver and gallbladder. So the general principles of the observation of the tongue. So first of all, the time is important when we look at the tongue. The best time will be in the morning when the patient wakes up. Of course, we cannot call the patients to come to our clinic first thing in the morning, but this will be the most exact diagnosis. Or if we ask the patient to take a picture of the tongue and send it to us, so it will be better to do it first time whenever they wake up in the morning. The light, the best light will be light of the outside, but of course we live indoors, and not all the time we have a good climate or next to the window. But when we take pictures or patient take pictures, we need to consider the color, if it's with the flash or without flash. So sometimes I will ask to do both when they send a picture. We need to consider if the patient ate something or drank something before. The best will be not to eat at least half an hour, 1 hour before, and to drink only water. If we see like a dark stain or dark area in the middle of the tongue, we don't necessarily take it to cancer immediately, but we can ask if there was coffee involved before. So advantages of this method, we can say that it's very simple. Okay, it's what we see. We can't argue much about what we see in comparison to pulse diagnosis, for example, when you can have many ideas or imaginations about what you see. So it's very simple, very easy to do that. It's very reliable in understanding the problem, because again, what we see is what we have. Now I can say that tongue diagnosis is good for like 80% of the cases. Okay, how would I know? I will always ask. I will not say, okay, I see you have this and that. Okay, I will ask, do you have a tendency for this or for that? Or do you suffer from this or that, and the emotional or physical aspects? Okay, so basically it's quite reliable. We can get, when we take a picture, for example, we don't have, the tongue. We can see a patient takes out the tongue for like 10 seconds, 15 seconds max. But we can take a picture and analyze it, and of course, to track the changes through a process. We have some kind of documentary that that we see the changes. Now, pulse, it's quite difficult to see how it changes. Of course, it's all about what we feel, but tongue is what we see, and it's very important. And after few treatments, many patients can say, I don't really feel much of a change, and I will go to the first picture of the beginning of the process, and I will say, okay, I see some kind of changes according to the tongue. It might say that there are changes in the body too. So hopefully it will be, the patient will approve that also. So of course we can do, we can get shooting, or patient can give us pictures from distance, from the other side of the globe, basically, and it's a big advantage. We can give recommendations for herbs, or for diet, or for different exercises. So the patient is not necessarily coming to our clinic and needs to do all the way to find the parking and to find the extra hours for that. He can just send us the picture before, and we can say, okay, you can come to the clinic to get acupuncture or whatever, but basically it's a good advantage. And also we can say, we can see different, we can detect different things or different problems at the beginning, and then we can refer the patient to more tests or exams with the doctors, and then we can follow that. The way of taking the observation, basically the best way to check it is, I talked about after meals or after drinking, but I do it in 2 steps. Basically, the first step, I ask the patient to take the tongue out much as possible, and then I need to see the root of the tongue, the Jing, okay, which means I will demonstrate like, okay, so to take it out much as possible, and later to release the tongue. And on the first part, I can see the heart, the Jing, and the liver on the sides. On the second part, I can see the internal organs like lung and spleen, the whole tie-in. So like to take it out strongly, and then to make it more loose and to see what's going on in the middle of that. Okay, because if we don't give instructions for the patient, they can play with the tongue, and there are those who can twist the tongue and do many kind of funny tongues that look like. So we need to give some instructions. Otherwise, we won't get a reliable diagnosis. What we look at. Basically, we start by observing 11 categories. The next step, I will show the different categories, and then it's like scanning from like the shape, color, coating, and so on, and then to look on the specific areas. So like scanning the tip of the tongue, like heart, then lung, then spleen, stomach, then kidney, and then the sides with the liver, gallbladder. Okay, so this is like the basic understanding for that, and then we can get the best treatment according to the whole diagnosis that we get. So we can relate to some psychological aspect, okay? Which means I can divide the tongue to 3 parts. The upper jiao, which is, we know it's the lung, the heart and the lung. Okay, heart and lung, they are both connected to the external communication that we have. So it's the interaction with the environment. It's it's the logic aspects. It's basically the vitality of the person. So when we see different changes in this area, again, we are searching for what is not balanced. Okay, we search for again different shapes or colors or different signs. So this is the first area, the connection to the outside. The middle jiao is connected to the digestive system, but digestion is both physical and emotional. And the physical, of course, is how the person digests food, but it's also how the person digests emotions, how the person or the patient digests himself or different situations or his reality. So many times we can see on this area that it's swollen, for example. Swollen is accumulation. Accumulation might be mostly of qi or of fluids. And when I see this kind of aspect, I immediately ask, are you disturbed in your mind? Like not disturbed as a problem, but do you think a lot? Do you have do you worry a lot? Do you have on the physical aspects? Is your abdomen swollen or painful? Okay, so I can relate to that. According to the answers of the patient, I will go deeper with more questions, and I will understand how the person reacts. The lower part, or the lower jiao, is the basic patterns, we can say, that connected to the unconscious aspects, kidney, water energy. Okay, so all kinds of fears the patient has. So for example, if it will be swollen in this area, so we might ask about any kind of fears or any kind of problems on the lower part of the body. It can be lower back or can be lower abdomen. Okay, but this is again just to give a brief introduction for that. And the orthopedic aspects, we can also see that when we look at the tongue as the whole body, we can see that the midline is like the spine, okay? And sometimes we see some kind of curves, okay? So it can be on the upper part, on this area, for example. So we can ask if there's a scoliosis or neck problems or upper back issues, shoulders on the sides here. The middle part can be middle back or abdomen, pelvis or hips on this area, or lower back. Again, this is another clue that we can see. The basic idea is that the midline is like the spine, and if we see different curves, it can be different problems of the spine. You can ask when you see that. If you see one side, for example, and the lower part is more squeezed, just for an example. So we can ask, do you have hip problems or lower back on that side? Okay, you can the patient will be surprised. How do you see that? So and immediately they trust you suddenly. Another aspect of when I look at the tongue is like I'm turning the person upside down. So the tip will be up here. It's like, oh, I'm sorry, something, oh, okay, one part is missing. Okay, but from the slide suddenly. But this is like the head, like the mental activities, mental part. If I see this area is turned down, okay, or weak, so I can immediately refer that to the emotional aspects. If the person is like down, or if the tip is raised up, so the person is up and, you know, has lots of vitality and with his nose up even, you know, like I'm here, notice me. We can see that here the lungs, here the abdomen, here is the legs basically, here are the hands. Okay, so when I look at the person, I refer that to the, I take it opposite, upside down, and I see the whole person. And this is really, really helpful. I mean, if I have one tip to give you, is try this for the next tongues that you see. Okay, so it's very easy to see how the person interacts with himself and with his environment. Now, I will show this slide also at the end, but I just want to show you the checklist that I do. I will start it from the right side to the left side. But basically, I consider, first of all, the shape of the tongue. So I have different options here, okay? Is it long? Is it round? I will go through this right now, but I look at the shape, then I look at the color, and see if I have something which is happening there, I will mark it, okay? Each one of these is connected to a specific syndrome. We can see that later on also. So I scan it, I look at the color, I look at the coating, and then I mark on the side the different syndromes, and then I go to the heart, check the tongue, different option, marking one of these. Then I go to the lung. If I have something, I will mark it. If not, I will skip to the next one, and so on. Kidney and bladder. Okay, with this checklist, it's becoming very easy to go step by step and not getting confused with all the information that we get. So if you, for example, copy this, or you have it next to you on a paper, so you can see all of that very easily, and it will help you eventually to decide which kind of treatment to give to the patient. Now, the 11 categories that I consider, here I see that we have some problem with the logo here, but I will go through each one of them. Now, you can see on this table that I have the category, then the meaning of that, and then where to check it. So there are things that I will check on the whole tongue, and there are things that I can see on the whole tongue, but also it will be more specific on the 5 areas. Okay, so if I start with the shape, for example, I will go through each of them right now. I see time is running, but basically we have the shape, we have the color, we have the movement of the tongue, which means on the sides or like trembling. We have the climate, if it's wet or cold, basically represents the fluids. The coating can be on the whole tongue or on specific areas. We have puffiness. Puffiness, it means that that basically there is some kind of stagnation. So again, it can be on the whole tongue or on a specific area. But if this is the tongue, okay, and I see just the middle of the part in the spleen or stomach area, over there, it's there's a stagnation, so I will ask directly about that aspect. On the sinking category, it means that there's weakness of the organ system. Okay, so specific area can be weak. So if it will be in the lung area, for example, just imagine the area of the lungs or chest is sinking. So it's like the person is like this. I'll show it from the side. So the person like this. So he might have neck problems. Okay, but also lungs are not functioning. And when the lungs are not functioning, might be phlegm, might be all kinds of respiratory issues, shorts of problems. Okay, of course we can go according to what we see. Cracks, basically they describe deficiency, but they don't have to be all over the tongue. They can be like a whole line, but they can be also in specific areas. That will mean that that specific organ system is dry from yin. We have veins under, which represent the blood circulation. We have spots and wounds or different ulcers, okay, and we have tooth marks at the end, okay, which represent basically spleen, but not only spleen. I consider it more connected to liver, actually, because it's on the area of the liver. So the liver needs to give the tonus or the movement. The wood gives control or all kinds of direction for the earth. So the liver is not present there. So he's weak too, the liver. So both of them, basically. Okay, so these are the 11 categories. I will give, I never saw a normal tongue, otherwise I would put it here, but this is the closest as I saw from what I saw. Basically, the color is pinkish, the shape is quite okay, quite round, even though here it's a bit more straight, but the left side of the tongue is quite good. There are no sinking area, there are no cracks, the coating is not too thick, maybe a bit here, but again, not a perfect tongue, not a perfect person. But it's quite clear. Even on babies, I didn't see many normal tongues. But this is close as possible. Okay, if you'll find any, please send me. I will add it to my slides. So I will go through the tongue shape. This is the first category. Okay, I will go through the whole 9 types in this specific category. The tongue shape basically gives us the information about the nature of the person, the way of thinking, the way of acting, and basic situation. Is it excess situation or deficiency? So the tip shape, of course, represents the emotional situation and the availability of energy, the vitality. Thickness is the immune, connected more to immune system. Okay, and the length is also about the constitutional energy that the person got and his potential energy. Okay, so we have the round, the triangular, quad, narrow and expands, wide, thin, thick, long, and short. Okay, so I will give now examples for each one of these, and as much as I have time, not so much, I will give some indications about personality. Okay, but I'll try to go through all of them. So the first one will be round. So round tongue, we can see that the shape on the outside is round. This represents that that basically the person is a round person. Now imagine, as I talked before about, we see the whole person in here. So who's this person? Okay, if we turn it upside down, so person might be a bit round, at least on his thinking or way of thinking, a bit slow, not acting so fast. If you'll put some pressure on him, he might get, inside, because he's a bit of, is more yin person. According to that, we can see also different symptoms, accumulation of fluids, chi stagnation, okay, and aspects like this. Basic symptoms will be spleen chi deficiency, lung chi deficiency, okay, basically. If you go to a triangular tongue, so this person is much more tight, okay, he's more tense, okay. It doesn't mean that he's under pressure all the time, but as a personality, he needs sometimes. This specific patient, when I asked him, are you under pressure, are you stressed? He said, no, I just act fast, I think fast, okay. And imagine, okay, turn upside down, you see a very fast personality, okay, he's acting fast, thinking fast, okay. If he might have a main syndrome here will be liver chi stagnation, or might be even liver fire if we take in consideration the color of the tongue. The quad, so we see here that it's quite square in a way. The sides are stiff, the tip is quite stiff and straight. This kind of person is a straight person, like thinking straight, very logic, not so smooth, not so flowing, and this might affect his ability of expressing emotion, for example. Okay, so different syndromes that we see here is, of course, liver chi stagnation, heart chi deficiency, lung chi deficiency, okay, because of the stiffness of emotions too. Okay, again, this is a brief one. When it's narrow and expands, we can see here that on the lower part, on the lower GR, more tendency for stiffness. It see problems on the lower part. But in my experience with tongues like this, it's dissatisfaction. Person like this might be not satisfied. Many times, even on the sexual aspect, that's what makes the lower part very stiff. And whenever this part is getting more released, so the patient or the person might be more loose. But there's a big difference between the lower part and the upper part. We can connect this also to the Daimai meridian and to see the differences in the body, the lower part and the lower part. Okay, the next one will be wide. This is obviously a very strong person. He's heavy. His immune system is quite strong, but he's heavy also on his mind, as in his ideas. Okay, we see it's wide because it takes the whole mouth area. Okay, next one will be thin. When the tongue is thin, we see it in here. In this specific one, it's also quite pale, and we see the lack of nourishment. But this is an indication for weak immune system. Of course, according to blood, there's not enough blood to support. So liver blood deficiency will be obviously here. Thick tongue will be a thick person, also might be on his appearance and his look, but also with the accumulation of the flesh. Okay, the flesh is quite thick and strong and heavy. Again, I see the time running. Okay, not much left. Long tongue, so it means that the basic energy is quite, the vitality and the fire is quite strong, in comparison to short, when we see a lack of fire or lack of vitality. So this specific person is actually an actor. On the stage, he gets his vitality or his fire energy. Okay, so we can see that also. The next ones will be, and again, I will just go with them in a brief way. The tongue color represents the blood condition, qualities, quantity, circulation. So we have pale red and purple, bluish. The tongue movement, we can see it's stiff, flaccid or trembling. We can see the types of climate with wet and dry. Tongue coating can be without coating, normal, white, thin, peeled, yellow, thin, and thick, and of course in specific areas, and this represents the progress of pathogens of heat or cold. We can go on with the swelling. Basically, as I said before, it's a stagnation of chi or yang deficiency, and of course it can be in specific areas. The types can be in lower, middle, and upper jiao. When it's sinking, again, it's qi deficiency, or might be also yang deficiency or collapse. We can see the tongue cracks as yin deficiency in different areas. Tongue veins, so the blood circulation, stagnation or stasis, and swollen or purple. Tongue spots, so usually they will represent all kinds of fever or heat, and they can be in different areas. Okay, according to that, we can see where the heat is. And teeth marks, again, the spleen weakness with not dispersing the fluids, like meeting the water, and also not enough tonus of the liver. So on the 5 association areas, I will go through this quite fast. We can look at the heart area. We consider it as fire element, all what fire represents. Again, I don't have enough time to explain this now, but of course the vitality, the passion of the person, and so on. Well, I will go fast on this. I just want to demonstrate the different tongues. So again, forgive me for doing this fast. So we have the heart and small intestine, but mostly the heart with the vitality of that, and all kind of imbalance of fire element, which can be cardiovascular, sleep disorders, stress, anxiety, restlessness, blood pressure, and so on. So we have like 8 kinds of tips. When the missing tip, I will show that just on this. I have explanations or specific tongues on each one of these. So I will show it briefly. So we have the missing tip, which is a weak person that doesn't have enough vitality. Okay, we can see the tip is quite loose or tense down, which the person actually with his head down and emotional, this is actually a person with depression, quite heavy depression. When we have a crack, so that indicates a yin deficiency. When we have the tip tends up, so this is a small kid with the fever, but again, this is like lots of vitality and restlessness, or if the tip is just red, so again, it will mean that there's a tendency to anxiety, sleeping disorders. When it's more sharp, so it also can give more indication. When the narrow tip, it also can indicate not only the emotional aspect, but also the neck area, okay, because this is the head and neck, so stiff neck and neck problems. And swollen tip can also indicate different problems of, I will say, even cardiovascular problems, so we need to consider that too. Lungs area, just briefly, we have swelling and sinking without coating, with cracks or one crack, white coating or yellow coating. Spleen and stomach, we have also 8 categories here, which we can consider the different aspects that we can see. And again, forgive me for not giving more details for each of these. Time is limited, but of course in the full course it's possible to get it all. We have also the kidney, bladder, and reproductive organs, also with the different indications. I will go that briefly, and 8 indications for liver area, liver gallbladder area. So again, I will go back to the checklist after we saw all that and we understand each one of the syndromes or each one of the signs and the syndrome that it represents. We can see all the indications and create a whole, I will say, syndromes and treatment that we can recommend. So basically, with the tools that we have, we can recommend about acupuncture or physical activity, manual therapy or herbal medicine, nutrition or emotional activity. All these basically give us the opportunity to give or to help to heal the person, or to help the person to heal itself. Okay, so we'll consider every one of you with the tools that you have. You can use these. I just want to give an example of how I'm using this in actual tongue, in actual case. So I have the different categories here with the tongue, and then I mark to myself. Usually I do it straight on the phone and I show it to the patient. So I see the different aspects. I see that the tip is a bit weak or loose. I see that the abdominal area is a bit swollen, so I mark it like heels. And I see the kidney area is sinking, and the sides will be sinking too on the liver. Okay, so basically I can say there's heart Qi deficiency, spleen Qi deficiency, kidney deficiency. Kidney Qi might be also in, we don't see because of the shade. But the liver is also weak, so also the liver can tend to blood deficiency too. Okay. And last example of case before, when we see the stiff mostly, so we look at the shape, triangular shape, we look at the color, quite reddish without coating, and then we see the tip is red and stiff, which means heart fire in a way, and some swellings here and the abdominal area. And after treatment, that's the tongue that we got. Basically, everything is more loose. The color is more pale in comparison, but again, it's more balanced situation. But the basis of the treatment was to regulate the chi of the liver. Okay, so it was quite fast. I went through all very fast because time was limited, but now I will be able to answer questions. Or Donna, if you are there and you want to give me like the best, or I don't know, whatever you can say. So you can, of course, contact me anyway. Hopefully we will have the course also in eLotus. But anyway, this is it. This is my limit of the time. I'm happy you arrived. Let me take a short, well, yeah, that's a lot. That's a lot. Let me see if there are any specific... Okay, I see people from all over the world, and it's warming my heart here from Tel Aviv. Okay, here it's still... Okay. I'm trying to look, forgive me for being so quiet. It's all about the checkings yet. Okay. Unfortunately, I don't see any specific questions so far. I see here, okay. Yeah, one thing that I see about left and right and the orthopedic aspects, usually, yes, it will take to the same side, but in some cases I saw it's also in diagonal. So, so it also can mean something. Okay. Missing tip. What is missing tip? Basically, missing tip, when we see, it's like, imagine that there's a missing part, okay? Not, it's not full. There's a part, if the tongue should be like this. So part of it is like missing or falling down. This is basically means that there's not enough chi there, not enough energy to provide the vitality. Okay, just for example. Anything that you want to say, Donna?
Thank you so much. That's what I wanted to say to you. And thank you everybody for coming to today's webinar. We hope that you learned something that you can apply right away to your practice. And thank you, a huge thank you again to Aaron. I know that you had a lot of information in here, and we're so grateful for that. Thank you for squeezing it all in. It was really great. And if you guys want to catch the recording for today's class, it will be available tomorrow afternoon on our TCM Wisdom Tube. And so be sure that you have an online account with eLotus. If you don't, please sign up for one today. That way you will get access to tomorrow's webinar recording, and we also gift you with the 1 CEU course of choice. That's it for today, everyone. Thank you guys so much, and we'll see you at our next webinar. Bye.
Bye. Thank you very much.